Welcome to the training on changes in mental status. A change in mental status can refer to any changes in brain functioning resulting in confusion, memory loss, loss of alertness, unusual thinking, poor judgment, emotional changes, behavioral changes, or personality changes. There are many possible reasons a person experiences a change in mental status, including infection, fever, medications or medication changes, low blood sugar, a stroke, liver failure, alcohol or drug use, consuming something toxic, a lack of oxygen, dementia, brain injury, concussion. What's important is recognizing that a change has occurred and seeking medical assessment and care as soon as possible. If the person's health and safety is at risk, contact 911 immediately. You might notice some changes in how a person speaks or acts that could indicate calling a medical professional is needed. For example, behavioral changes, a walking pattern change, changes in oral or hand motor control could indicate a need to seek medical attention. A person could forget what day it is, lose attention more easily, forget the names of things or people that they normally know, repeat a question again shortly after it was answered. They could begin stumbling or falling or drooling or have trouble swallowing. Are there changes in how they move physically? How their memory is, their mood? Are there changes in their behavior, in their overall health? What looks different compared to baseline? Baseline, how they normally are. What is baseline? Baseline is defined as a minimum or starting point used for comparisons. In relation to mental status, it refers to how a person is typically prior to experiencing changes. It refers to the beginning measurement of behavior. So by knowing what is typical, you can help identify when changes in a person's mental status or their baseline occur. Without baseline data, it's difficult to recognize changes. By talking to the individual, talking to those who know the individual, and observing them, it can be helpful when changes occur to have an understanding of what their baseline is. Think about what baseline means for the person. What's their typical mood? What is their typical sleeping pattern? What is their typical communication style and pattern? What is their typical activity level? Things to consider when determining a baseline change. If a change has occurred, does it occur across multiple environments? Does it only happen at home? Does it happen at home and at day support? Does it only happen at church? If a change has occurred, has the individual seen their primary care physician? If a change has occurred, has the individual experienced any other changes recently in their life? Something stressful, a recent move, a new housemate, a new support coordinator, a new support worker, the death of a family member. Changes can be sudden or gradual. So sudden changes require an immediate response. They're happening immediately. Gradual changes can be discovered by making a list of what a person could do in past years and comparing it with what they can do now. Asking those who know the person well if changes are apparent is an important way to identify gradual change. It can be difficult to recognize mental status changes in people with developmental disabilities. People with developmental disabilities are at risk for dementia as they age. This is especially true for people with Down syndrome who have a greater risk of developing the condition and to do so earlier in life. What is dementia? Dementia is a general term that describes diseases and conditions that lead to loss of memory and learning skills and the loss of abilities to perform everyday activities. There are different types of dementia, like Alzheimer's disease, vascular dementia, which is caused by brain damage, usually following a stroke. There's Lewy body dementia, which is related to protein deposits in the brain. Frontotemporal dementia refers to a group of uncommon brain disorders that primarily affect the frontal and temporal lobes of the brain. A professional assessment to determine if someone has dementia includes a full physical examination looking at medical, psychiatric, and social history, completing diagnostic tests such as magnetic resonance imaging and the use of dementia screening instruments. In the early stages of Alzheimer's, a person may function independently. He or she may still drive, work, and be part of social activities. Despite this, the person may feel as if he or she is having memory lapses, such as forgetting familiar words or the location of everyday objects. Symptoms may not be widely apparent at this stage, but family and close friends may take notice, and a doctor would be able to identify symptoms using certain diagnostic tools. Middle stage Alzheimer's is typically the longest stage and can last for many years. As the disease progresses, the person with Alzheimer's will require a greater level of care. During the middle stage of Alzheimer's, the dementia symptoms are more pronounced. The person may confuse words, get angry or frustrated, and act in unexpected ways, such as refusing to bathe or calling people different names. Damage to nerve cells in the brain can also make it difficult for the person to express thoughts and perform routine tasks without assistance. In the final stage of the disease, dementia symptoms are severe. Individuals lose the ability to respond to their environment, to carry on a conversation, and eventually they lose the ability to control movement. They may still say words or phrases, but communicating pain becomes difficult. As memory and cognitive skills continue to worsen, significant personality changes may take place, and individuals usually need really extensive care. Caregivers will need to make specific modifications in a number of areas. For example, communication. Use visual cues, simplify directions, maintain respectful tone. Don't correct individuals if they forget something. Put the most important part of the sentence last. Instead of, get in the car, we are going to work, say, we are going to work, get in the car. For behavior, time events and activities for earlier in the day. Calmly redirect when the individual gets agitated, limit noise and distractions, create a life story to engage memories and promote meaningful interactions, provide a clutter-free, well-lit environment, lock hazardous chemicals and medications, monitor, protect against wandering, and monitor for secondary conditions. Those are all ways to ensure that somebody with dementia can still live a successful life. Recent randomized controlled studies have shown the efficacy of music intervention in improving the well-being of individuals with dementia and their caregivers. Music can elicit emotions and memories and help provide a link to the person's past. It can promote interconnection with caregivers and others with dementia. Musical training appears to delay cognitive decline and promote brain plasticity in the elderly brain. Music therapy can help agitation as well as other recreational activities, and people with dementia usually respond better with individualized activities, including personally preferred music. Creating life stories with an individual with dementia can have far-reaching benefits for the individual, caregivers, and meaningful people in that individual's life. It records important details and events from the individual's past and present. Creating a life story book helps the individual recall past events, which may improve the individual's mood as they reminisce about the past. These stories foster communication, strengthen relationships, and promote person-centered care. Creating a life story involves working with the individual and people who know them to gather facts about their life, important events, interests, preferences, as well as gathering photographs or even news stories or memorabilia that help tell the individual's unique life story. This can be a really beneficial tool in working with someone with dementia. This has been your course on changes in mental status. Do not forget to review the resources down below and take the test. Thank you. Good luck.